Hi class, we are going to review in this lecture a PowerPoint from book chapter number 16, and then this one basically has some review material from our book. So this is on anti-inflammatory, anti-arthritis related anti-agents. So this chapter is on different medications that are functioning as anti-inflammatory medications. Now, to begin with, this is a little cascade. What happens is at the beginning of tissue injury in your body, there is exposure to cell membrane causes activation of Hagman factor. Hagman factor will activate the kinins, and kinins will activate bradykinin. Bradykinin will activate release of arachidonic acid that will cause prostaglandin release, leukotrienes, and phagocytosis at the end. Also, tissue injury releases histamine that causes vasodilation and allergic responses. So we know that antihistamines will block the histamine release, and that's how they're anti-inflammatory. Corticosteroids will reduce the release of arachidonic acid. NSAIDs and salicylates will work here to stop prostaglandins. And then antrocept and anacarins, they work here on leukotrienes inhibitors. And gold salts, they work over here on phagocytosis. Okay, anti-inflammatory, anti-arthritic, and other related agents. So we know some corticosteroids are anti-inflammatory medications, as antihistamines are also anti-inflammatory medications, which are such as Benadryl. Corticosteroids are just flucortisone, hydrocortisone. Immune modulators, we're going to study in the next chapter. They are under MABs like rituximab. So MABs, over-the-counter anti-inflammatory medications, and they are all combination. So salicylates are the one that blocks the inflammatory responses. They're given mostly for they have very strong fever blocking abilities and also have analgesic properties. Some common medications are aspirin. Aspirin we use it very commonly, but it's mostly used for antiplatelet function. It treats the inflammatory conditions. And then balsicide, it is used to treat ulcerative colitis. Then some magnesium, choline, magnesium trisalicylate, it treats the mild pain, fever, and arthritis. Then diflunisal, it treats the moderate pain and arthritis. Then we have olacizine, mesalamine, and salicylate. These are just different salicylates. What do? They inhibit the synthesis of prostaglandins used to treat mild to moderate pain and fever. They start functioning in 5 to 30 minutes. Remember, we're not giving it to a person who's already allergic to it. Before giving medication, always ask, hey, are you allergic to it? And they say no, then okay, then give it to them. Or you always ask for allergies. Check for their kidney functions and any kind of bleeding abnormalities, because this medication causes bleeding and is not great on kidney function either. Adverse effects could cause effects on stomach and clotting systems. Drug-to-drug interaction, interact with other drugs by interacting with absorption. So question 1 is, if a person who does not respond to any salicylate may respond to a different one. True, not necessarily all bodies react similarly to the same medication. We can always try another one. Non-steroidal anti-inflammatory medications provide strong anti-inflammatory and analgesic effects sold over the counter, which may lead to abuse. Anti-inflammatory, analgesics, and antipyretic effects. So NSAIDs, they are therapeutic actions and indications block two enzymes known as COX-1 and COX-2. Pharmacokinetics rapidly absorb from GI tract, reaching peak levels of 1 to 3 hours. They are metabolized in the liver and excreted in the kidneys. And contraindications, remember, allergies, if a person has GI bleeding, pregnancy, lactation, any other problems such as cardiovascular problems, high blood pressure, peptic ulcer disease. I will double check with the physician before giving it to them. Adverse effects, they cause nausea, vomiting, dyspepsia, GI irritation. They are very bad for GI system because they cause not only dyspepsia but also GI bleed. dizziness, numbness, platelet inhibition. They cause bleeding disorders, high blood pressure, and even bone marrow depression. What is bone marrow depression? They will cause RBC, WBC, and platelets, platelet level to go not to be down because they're not produced effectively in bone marrow. Drug-to-drug interaction: when these drugs are taken in the loop diuretics, there is a potential for decreased antihypertensive effects of beta blockers, and the drugs are combined. They have been reported for lithium toxicity, specifically combined with ibuprofen. Non-steroidal anti-inflammatory drugs, related drugs could be, some of these examples are ibuprofen, phenylprofen, diclofenac, very commonly used, mefenamic acid, meloxicam, celecoxib. Tylenol, also called as acetaminophen, acts directly on the thermoregulatory cells of the hypothalamus. Mechanism of action: it is used to treat fever and pain, treat fever and pain associated with a variety of conditions, including influenza, prophylaxis of children receiving DPT immunization, and relief of muscle pain associated with arthritis. Tylenol is absorbed from the GI tract. It peaks in half hour to 2 hours, means like that's the max effect. Like 30 minutes of taking medication, a person starts to feel that pain relief and fever relief. We should always check for allergies, any kind of liver dysfunction or pregnancy or lactation before we give to the patient. Tylenol is also hepatotoxic, so we always check for liver functions before we start giving these medications. Drug-to-drug interaction could cause oral anticoagulants, increases bleeding, hepatotoxicity with barbiturates, carbamazepine, hydantoins, and rifampicin. When are NSAIDs contraindicated? Allergies to penicillin, sulfonamides, antihistamines, or thiazines. Allergies to sulfonamides. Anti-arthritic agents. Arthritis, potentially debilitating inflammatory process. We know what is arthritis, and it's inflammation in the joints. Our older population usually gets it because it's from wear and tear into joints. Some medications that are given to treat this disorder is gold compound. It is absorbed by macrophages, which results in inhibition of phagocytosis. We always, before giving these medications, we check for allergies, any kind of diabetes, renal and hepatic abnormalities, pregnancy and lactation. Adverse effects could cause stomatitis, glossitis, gingivitis, bone marrow depression, dermatitis, intestinal pneumonitis, and anaphylactic shock. Drug-to-drug interaction: penicillamine, antimalarial, cytotoxic drugs, and immunosuppressive agents. Disease-modifying anti-rheumatic drugs available for treating arthritis that aggressively affects the process of inflammation, can be severe to life-threatening. They alter the course of inflammatory process. They're given for arthritis. Tumor necrosis factor blocker. These are another set of medications that will block the TNF factors. They will slow down that cytokinin function, and that could cause the death of tumor cells and stimulate a wide variety of pro-inflammatory activities. Okay, it could be given subcutaneous, IV, and peaks in 48 to 72 hours, and usually the half-life ranges from 115 hours to 2 weeks. Tumor necrosis factors blockers. Contraindication: cannot be used in anyone with acute infection, cancer, sepsis, tuberculosis, hepatitis, myelosuppression, demyelinating disorders, pregnancy, lactation, hepatic and renal disorders. Adverse effects include black box warning from risk of serious fatal infections and development of lymphomas and other cancers. Actions include variety of these medications. Actions will be varied with some other medications which are immune modulators. Contraindications: if a person is allergic to these medications, if they're pregnant, lactating, or have kidney or liver disorders, always double check. Adverse reactions are hepatotoxicity, local reactions. Drug-to-drug interactions, we want to make sure that they're not taking any other medication that could cause liver disorders. That is just a little bit of review of the book, PowerPoint from the book, and I know it's a small little recap. just a little review of what the book says about these medications. All right, and then you can the main PowerPoint is Professor Lee's, which is PowerPoint 1, that has specific more information. Specifically, what is required of you from these lectures is to review more on salicylates and Tylenol, which is acetaminophen. Okay, that's it for video number 2. Thank you for listening. Okay.